Hey all, it's Dan back with another video. Before I start this video about masks, I'd just like to say my intention for this video is to reveal the numerical patterns involved in this story and also to talk about the effectiveness of face masks in dealing with the coronavirus, etc. So I would ask for protection from all sides as I do this presentation, from above, from to the left, to the right. I'm imagining a spear around me and below to protect me from any negative entities. All right. So I saw the story today on Fox News, their website. Does wearing a face mask pose any health risks? So the subheading is several states have mandated face masks in public as coronavirus cases have surged. And they headlined this guy, Dr. Mark Segal, and they asked, does wearing a mask pose any health risks? And they say right off the bat, no, not for most people. Babies and toddlers should not wear masks because they could suffocate. The same goes for anyone who has trouble removing a mask without help. Others can wear masks without risking their health, according to experts, despite false rumors to the contrary. So let's look at the numbers behind this. And there's a picture of me. So this happened on a day with 49 numerology. All this talk about masks and health risks 49 as well. And face mask equals 49. So how appropriate that we should be talking about face mask on a day with 49 numerology and the health risks. Also, the doctor, his full name, Mark K. Segal, equals 49. So very appropriately. Health risk is also 57. And face masks is 57. We'll talk about health risk of face masks. Health risks is 68. And Mark K. Segal equals 68. Dr. Mark Segal equals 60. So they call him in the article, health risk equals 60. 60 or 6, the number of man. And the guy in the article, they talk about this guy, Newman, equals 68 as well, just like Mark K. Segal and health risks. So let's look at Mark Segal. Born June 15th, 1956. Interesting. He's 64, born in New York. He's a Fox News medical contributor. So Mark Segal equals 56, and he was born in 1956, right? And coronavirus equals 56. That number we've seen all year long. Coronavirus 56, born in 56, his name equals 56, right? Also 56, that number of mind control in the same cipher. That's what this is. Propaganda, mind control. So from his last birthday to this news story is 17 days. And that's interesting because mask equals 17. And he was born on a day with 42 and 33 numerology. Segal, his last name equals 33. Appropriately named. Face masks equals 42. And if you look at the number of weeks exactly it was from his birth to this story is 3,342 or 33 and 42. Thought that was interesting. And then he was born on a day on the 167th day of the year. Health risks equals 167. 167, the 39th prime, like that number of masonry, 39, also 33. And his last name, Segal, 39, just like masonry. Masonry and Segal, both 33 and 39. So let's continue on. When looking at this article, I saw these pop-ups on the Fox News thing, advertising for masks at Tessie, I don't even know how to pronounce that, tessienet.com. All the different styles of mask. A huge business has come out of this. Also lbabe.com. Selling masks. So Tessienet, or whatever you want to say this, equals 44. Why is that interesting? lbabe equals 44. Just a coincidence, right? Mask equals 44. Interesting. And it's interesting because hospital also equals 44. And I just learned that the first hospitals were military hospitals. And 44, a military number. Military equals 44, just like hospital. So what a shocker there. Also, wearing a mask can lead to lack of oxygen or hypoxia. Hypoxia 44. Let's look at hypoxia. There's something called silent hypoxia, and in a New York Times opinion pieces from Wikipedia, emergency room doctor Richard Leviton reports a vast majority of COVID pneumonia patients I met had remarkably low oxygen saturations at triage, seemingly incompatible with life. Right? So they had low oxygen. That's what hypoxia is, low oxygen. You're wearing a mask, it's covering your face, it's covering your nose, how you breathe. It's common sense, right? There's a story here in April about masks fail to filter virus in coughing COVID-19 patients. And a friend of mine posted this on Facebook. Look at all the air gaps when you're wearing this surgical mask. Air gaps there, air gaps here, air gaps below. So plenty of room for the virus to get in there. And yet people are wearing these masks thinking that they're safe. So also the business of mask wearing, of selling masks is huge. $74.9 billion in Q1. 74, that number of gematria of a cult, right? 74, and they're expecting an annual growth rate of 53% the next 7 years. Everybody's buying masks. So I saw this posted from Mass Science, the Journal of Neurology or Neurosurgery says preliminary report on surgical mask induced deoxygenation during major surgery. Our study revealed a decrease in the oxygen saturation of arterial pulsations. From the New England Journal of Medicine. We know that wearing a mask outside healthcare facilities offers little, if any, protection from infection. There's a bunch of quotes from Journal Headache. Most healthcare workers develop de novo PPE, such as N95 face mask associated headaches or exacerbation of their pre-existing headache disorders. Both surgical and cotton masks seem to be ineffective in preventing the dissemination of SARS-CoV-2 from the coughs of patients with COVID-19 to the environmental and external mask surface. It's from the Annals of Internal Medicine. So the Journal of Life and Environmental Sciences says the study showed that the filtering efficacy efficiency, of cloth face masks were relatively lower, and washing and drying practices deteriorated the efficiency. So if you're going to wash your cloth mask, it's going to not make it less effective than it already is. So there's a bunch of stuff here. It's kind of hard to read. That's why I was reading it to you. Also, I like reading things to people. American Journal of Infection Control says face mask use in healthcare workers has not been demonstrated to provide benefit in terms of cold symptoms or getting colds. And this is contrary to what everybody's saying. All the authorities, so-called medical experts, these people that want you to wear masks. It's so funny too, because I went to go pick strawberries with my daughter the other day, and we went to this farm, and right out front, they require you to wear a mask while you're in the field picking strawberries. And I was like, all right, we're not going here, And I talked to somebody there, and they're like, well, we want to be very careful about, people coughing or getting droplets on the strawberries. I'm like, oh my God, people are insane. So, masks don't work. A review of science relevant to COVID-19 social policies came out in June. And it says there have been extensive randomized controlled trial studies which all show that masks and respirators do not work to prevent respiratory influenza-like illnesses or respiratory illnesses believed to be transmitted by droplets of aerosol particles. Furthermore, the relevant known physics and biology which I review are such that masks and respirators should not work. It would be a paradox if masks and respirators work given what we know about viral respiratory diseases. The main transmission path is long residence time aerosol particles, which are smaller than 2.5, I don't know, it's very small though, which are too fine to be blocked, and the minimum infective dose is smaller than one aerosol particle. The present paper about masks illustrate the degree to which governments, the mainstream media, and institutional propagandists can decide to operate in a science vacuum or select only incomplete science that serves their interests. Such recklessness is also certainly the case with the current global lockdown of over 1 billion people, an unprecedented experiment in medical and political history. So they say they're talking about science, but they aren't. And here's a little review of the medical literature from these different studies. From Jacobs et al. 2009, use of surgical face masks to reduce the incidence of the common cold among healthcare workers in Japan, a randomized controlled trial. The conclusion is that they're wearing N95, which is supposed to be the top of the line, which significantly more likely to experience headaches. Face mask use in HCWW was not demonstrated to provide benefit in terms of cold symptoms or getting colds. So, it's not working, yet they're pushing it. You can go here and check it out. So, then I saw this thing about Alan Dershowitz, and I had seen this quote before. It says, "Why cotton masks do not stop the coronavirus." And here's a very chilling thing that Alan Dershowitz said on May 17th. He said, "You have no right not to be vaccinated. You have no right not to wear a mask. If you refuse to be vaccinated, the state has the right to take you to a doctor's office and plunge a needle in your arm." That's pretty chilling. Very chilling. In this article, it says children are more likely to die from being hit by lightning while waiting for the school bus than they are from being infected by the coronavirus while they're at school. Right? It's what you look like when you deprive yourself of oxygen. And look at Washington State. This is up to May 30th, apparently. Washington State had no increase in fatalities in the past 3 years. So, Alan Dershowitz, what a character he is. He said this on May 17th, And his birthday is on September 1st, and it's 108 days from his when he said this to his birthday. And that is interesting because Dershowitz, Alan Dershowitz, his full name equals 108. Also notice the 270, the ritual number, 27. And 517 is usually the 137th day of the year. Usually, day 17th. 137, of course, the 33rd prime. Mr. Dershowitz, Alan Dershowitz. You know, a mouthpiece. Look at that. He's got 66 numerology. 33, write out 33 equals 66. Also notice the 57. We were talking about face masks before, equals 57. Right? He's a lawyer. So, thanks for watching this video. I have one other thing to mention. The little subheadline they had said several states have mandated face masks in public as coronavirus cases have surged, which equals 1130 or 113. We know that number of bullshit, of not true, of fiction, right? And then from the pandemic to this story is 617 days. Why is that interesting? 617 is the 113th prime. And I'll prove it right here. Alright, so this is a bullshit story. This is bullshit, basically. 113, not true. Spell it right. True 113, we've gone over this before. Fiction, bunch of words that equal 113. This is in the mainstream. Lies and deceptions. Also, what they use to deceive people, a green screen, 113. So that'll do it. Thanks for watching this video. Everybody have a great day. Talk to you later.